Bronny James and Damar Hamlin are just two high-profile athletes that have been in the headlines this year because of sudden cardiac arrest while at practice or at a game. Hi, everyone. I'm Johanna Gomez, and I am your host for today. We hear of high-profile athletes, but there are hundreds, if not thousands, of kids like Alexander Bowerson and Nathan Higuera, two high school athletes who collapsed during their athletic practices and lived to tell their story. With the fall professional and high school sports season in full swing, this new season brings renewed warnings from health experts. It is important to know the risk factors that can help prevent these tragedies and sports-related injuries, as well as recognizing the signs to act quickly. We are joined by Medical Director of Sports Cardiology, Dr. Eli Friedman from Baptist Health Miami Cardiac and Vascular Institute, and Primary Care Sports Medicine Physician with Baptist Health, Dr. Alex Mafdali. Thank you so much, both of you, for joining us today. Before we dive into the conversation and I ask you all these wonderful questions, I want to remind our viewers to send in your questions and your comments down below in the comments. We are here for you and happy to answer any questions that you might have. So Dr. Friedman, we're going to start off with you. I am a parent of a freshman who plays basketball. He is an athlete, and I just feel more than ever, I've been hearing a lot about this just like everyone else. Is it that the numbers are going up, or is it just the news media coverage that's all over it now?
Yeah, it's a great question. I appreciate the question. I think certainly we're well more aware of this than we were before, and we've heard about a lot of these high-profile events, even going back several years to a soccer player who collapsed in a very public setting. So the temptation is to think that, hey, this is happening way more often and we should all be worried about it. But the truth of the matter is that exercise is the healthiest thing that any of us can do. We need to be getting people out there doing more of it, not less of it. Certainly cardiac arrest is a known thing that can happen during sport participation, but it can also happen during other times as well. So the data does not suggest that this is happening more frequently, and rather our focus should be on let's getting people out there playing and playing as safe as possible with safety nets in place to help if something really terrible happens.
That's a good thing to know, but still, we have to be proactive of
Absolutely.
it, which probably is like the biggest thing as parents or even as coaches that we have to think about. What should we actually look for? Because there are a lot of other injuries. It just doesn't have to do with this, right?
Yeah, I mean, there are a lot of other injuries that can happen during a lot of different sports. Every sport has a different risk.
Yeah.
I'd say for the most part, when you talk about football or basketball, these are contact sports. Mm-hmm. Other injuries in football could be a concussion, could be heat-related illness with all the equipment related to it. But majority of the time you end up with musculoskeletal injuries, lower extremity injuries that have their own ways of getting back to where they need to be in order to play appropriately. But heat illness and concussions are really what I manage on the other side.
Okay, so with concussions, I think it's very common as well. My son fell at a basketball game, and there was a protocol that happened. Do all these schools here in South Florida have a protocol, and is everyone aware of it? When should we freak out? When should we just say, let it be?
Right, yeah. I'd say pervasively, there are concussion protocols across the state, across the nation, and it's really important to touch base with your healthcare system to see what protocols are in place. I know that from a high school perspective, there are athletic trainers at every high school football game that know their athletes and that are aware and watching the football games for any alarming signs of a head impact or dizziness, headache, vomiting. Athletes are taken out immediately, evaluated by them, by an athletic trainer to determine if they had a concussion or not, and then really can have a return to play protocol if they're diagnosed with the concussion to ensure safety to the field.
Right.
It starts as simple as resting for a day or two to make sure that the symptoms resolve, progressing by getting on a bike to try to stress the heart, stress the brain, stress the vascular system to see if it can tolerate an increase in the heart rate, whether it to be 50 to 70%, to see if there's an improvement or a recurrence of their symptoms.
Right.
If they have symptoms after they're going on a bike, they may not be ready to go to the next step to get to a practice.
Right.
And once you can demonstrate you could do good on a bike, you start running, you start doing drills, and you really allow an appropriate, safe return to play protocol before they're ever in a position to get hit again.
I think that's a great thing because I think automatically any athlete's like, I want to get out there again and just prove that I'm okay. But those are great things to have in mind.
Right, and that's where we come into play and try to help the athletes and save the athletes from themselves wanting to get back too soon.
Okay, so we hear a lot about pre-screening. I have to do it as a parent. A lot of parents and schools have to do it as well. But really, should they have a specific screening before they do any participation in any sport at all?
Yes, I think a pre-participation physical exam and a history is really important, and it's a key time for anybody, whether it be an elementary school athlete all the way through our professional athletes who Dr. Mafdali and I get the privilege of taking care of. This is a time for somebody to check in with the healthcare team, get to know their healthcare team, whether that's on the professional side or, hey, I'm just going to meet my pediatrician again for this year and check in and see how things are. But it's a really important time for people like Dr. Mafdali and I to talk to the athlete. Any family history that's really concerning here, any little skipping or racing heartbeats, chest pain, difficulty breathing, that somebody's just brushing off and saying that's nothing, but could be a sign of something more nefarious that we need to dig into. Again, I can't overstate enough, playing sports, being active, exercising, the healthiest thing anybody can do for themselves, and we need to get more people doing that. But occasionally these things come up, and it's really important to pay attention to it.
Is there anything we can do to prevent it?
Yeah, it's a great question. This has been looked at over and over and over again, and certainly we can touch base on the ECG debate, the electrocardiogram debate, and whether or not getting an electrocardiogram on all of our students, all of our athletes makes a lot of sense. I'm happy to get into that if you want. The truth of the matter is that no real study or any data has suggested that we can be ahead of this better than we can with just sitting and talking to people, doing a really good physical exam, and working within a healthcare team. So again, Dr. Mafdali and I are constantly talking. We're constantly working with our athletic trainers. We're working with teachers and administrators at schools, really putting that safety net out there so that if something happens, if something sneaks through the cracks, that we have ways to find it later on. But from the preventative standpoint, that's a really tricky conversation to get into.
Yeah, because that's very, it depends, I guess, I'm assuming, the patient and this athlete and their history. So it changes with everyone.
Yeah, and family history too.
Correct.
So let's just talk about the gorilla in the room, which is the electrocardiogram. So anybody can get an electrocardiogram. If I decide with my children or Dr. Mafdali one day with his child that, hey, I want to get an electrocardiogram to screen for silent cardiovascular disease that could be relevant for participation in sport, well, that's great. We can certainly make that decision individually. But when we start mandating that and putting it out there saying everybody must do this, then we find ourselves running into a little bit of trouble there, because if you find something, there's downstream testing and not a lot of expertise in dealing with the heart of an athlete, which is really quite challenging when you get down into the nitty-gritty of it. So it can be done, the electrocardiogram, but if we start mandating it for everybody, we're going to find ourselves in some tricky waters pretty quickly.
Oh, that's heartbreaking to hear.
But I don't know heartbreaking. Again, like we don't want to look for ways to keep people out of sport. We want to keep people playing, but we want to do it safety, exactly. And the ECG has not been shown 100% of the time to keep people safe.
Oh, I've heard and I've seen different factors: dehydration, muscle cramping. We've seen professional athletes just have to sit out for a second because they have a muscle cramp. How about dehydration? Does that all have to do with it? Is it all connected?
I think they all play a factor into an athlete going down, right? An athlete going down in the field, everyone's thinking, what happened? Did they see him initially going down? And majority of the time, when an athlete voluntarily goes down and asking for an athletic trainer to be evaluated, they likely have muscle cramps, and where you can see them being evaluated and massaging them to try to increase that blood flow. But there are a lot of factors that we could tackle in the beginning, before the game starts, during off season and conditioning, to making sure that these don't become problematic during a game, including adding electrolytes to your drink, to making sure that you have enough sodium to last you throughout your play, working with a nutritionist to making sure that you're having the appropriate nutrients, the appropriate amount of vegetables, carbohydrates, protein, and fat. Then really, if you look at your urine, you can really determine if you're well hydrated or not.
Oh yes, look at the color.
Right, look at the color.
Let's be honest.
If it's clear, you're usually in the clear, right?
Yes,
if it's darker yellow, it's really a sign that you're getting dehydrated, and you don't even want to get to that point. You want to catch it before that happens. So just being aware of your body, staying hydrated the night before the game, during the game, and after the game are good models to go through.
It just sounds so much easier than what it actually is. I'm not an athlete and I'm like, oh, I'm a little bit dehydrated, and we all go through that, right? So speaking to a young high school student who wants just a bunch of sugar, it gets tough, right? It gets tricky. Dr. Friedman, talk to me about what is an AED. School us on that.
Yeah, so I'm happy to. Here's my best friend right here. So the AED stands for automated external defibrillator. You see these, we source this here locally in the building we're we're in now. You see them in airports, you see them in grocery stores, you see them all over the place. This is a device, and I'll open it up as we're talking here, if I can find the zipper on it. But essentially, this is a device that will shock the heart if a dangerous rhythm happens to take place, and if somebody goes into cardiac arrest. This thing will not hurt you, it will not harm you, it won't shock you in and of itself, and it is a foolproof method which helps to ameliorate cardiac arrest if it happens. So what happens if somebody's down, if they're unresponsive, if they're having seizure-like movements, if you've seen something and you're not sure, you should assume that this is cardiac arrest. So start CPR, call 911, ask for help, but find this thing, put the pads on somebody, and follow the instructions that it tells you to do. It will help you shock the heart. And these things should always be within 3 minutes of any athletic field at any time.
So every school has this?
Let's hope so, yes. And if they don't, call us, we're gonna help you get them, because this is the thing which saves lives. If there is a rhythm that will absolutely need to be shocked, this thing will do that. If we do it in 3 minutes, we know survival will be better at the end of the day. And here at Baptist, we've got a CPR program, we've got an AED program. Call us, we wanna come, we wanna train you, we wanna teach you how to use these things. You're more likely to perform CPR in your own home than you are on an athletic field. So you have the chance to save somebody's life in your own family by learning these skills.
Are there any other emergency protocols that we should have in mind if we are in a situation that we need this?
Yeah, I think number one is the recognition. So understanding what cardiac arrest looks like. Again, non-contact collapse, somebody who goes down for no good reason whatsoever. Seizure-like movements. If somebody's having what looks to be a seizure, that can be cardiac arrest. Obviously not breathing, no pulse, or complete unresponsiveness, that should be presumed to be cardiac arrest. Call 911, start pushing with CPR, and if there's one of these things around, get it, put the pads on, and follow the instructions. If that is done, and it's done in a timely manner, the outcome's gonna be much better at the end of the day. So the protocols that you talk about, learn CPR, learn how to use the AED, call us here at Baptist. We wanna come, we wanna train you, we wanna teach you how to do this.
So you guys are obviously working with a lot of South Florida sports team and schools.
Yeah, we work across all divisions, whether it be professional, collegiate, high school, and elementary. A lot of our Baptist employees are present in making sure that we are available for you. There are a lot of athletic trainers that have contact with us on a daily basis to making sure that we keep in communication and are looking for red flags and doing the workup we need to making sure that they get back appropriately.
What can we do as parents?
So you can trust in us that the physicians employed by Baptist and all the ancillary staffs, the athletic trainers, the coaches, everyone affiliated with us are trained to be able to implement CPR, and emergencies happen, and having an appropriate action plan to tackle these is important in what we have and what we can guarantee.
All right. Okay, so we're going to get to some questions now that we have for some of the viewers. Is my child at risk for sudden cardiac arrest if he doesn't play sports? Which I think is a valid question. We've been talking about a lot of athletes, but this can affect anyone.
Again, I appreciate the question. So yes, you're exactly right. It can affect anyone. And that's where part of the ECG debate comes into this too. If we were to do something like that, are we only limiting it to athletes? Are we doing it on everybody? And that's part of the challenge that we run into there, and part of the reason why it's not done. So to your point, we are now playing people in professional sport, let alone even high school and college sport, with known heart conditions, because we have found that the data tells us that these issues can arise not only during sport participation, but like I said, they can happen just as easily at home, in the dormitory, at school. These events are not isolated to the sport field and may not be more likely to happen there. So to limit this just to athletes and say that this is a problem of athletes does injustice to those who may be more inclined for other things as well.
Okay. Does race play a role in being predisposed to sudden cardiac arrest?
So the answer is yes. We know that black males are more at risk for this than white males or females in general. The answers as to why that is are very complicated, and we don't particularly understand why that is. More study needs to be done, and I'm fortunate to work with colleagues in the field who are doing this study and are going to get those answers for us. But we do know that black males do have this happen more frequently, and we need to understand why that is.
Okay. How common is sudden cardiac arrest in young athletes?
Do you want to take this one?
Sure, yeah. I mean, I think it is a rare occurrence, but it does happen.
We obviously hear about it all the time.
And it's important, like we alluded to earlier, that emergencies happen, and having an emergency action plan and a structured way to go about it will save lives.
What would you say is the biggest takeaway you want us as parents, as coaches, to actually just be aware of?
Yeah, I think the biggest takeaway, again, I've said it over and over, is that number one, being active, exercising, playing sports is the healthiest and best thing we can do. We know the kids who do that do better in school, do better after school, and are just overall more prepared to handle the stressors of life. So sport participation is healthy and it's safe, and we need more people doing that. With that being said, the annual pre-participation exam, the annual physical with our pediatricians are really important. That's a time to check in and make sure not only cardiovascularly, but that everything is okay. And number two, be very aware of our family histories. If there is congenital heart disease in the family, people who've died suddenly with no good cause or no unexplained reason, get that evaluated, because that can be an indication in ourselves. And then probably most importantly, get to know this thing, how to use an AED, how to perform CPR, call us and we can help you to do that.
If you have no family history though, it's still something important that we should say, still go get checked, right? Don't ignore any of the signs that you both mentioned.
Correct, yeah. I'd say if someone came in complaining of unexplained shortness of breath that is not expected with that particular demand, I'd be worried. I'd be wondering why they're short of breath. That could be related to an underlying cardiac issue that I would recommend getting worked up for. But then again, if you have someone that says, yeah, I get a little tired when I play, it usually stops, I have no family history, the vitals are okay, you feel comfortable that likely they can participate, and anything can happen to anyone on the field, and we're just making sure we provide prevention and screening for those that need it.
Yeah, absolutely. Gentlemen, doctors, thank you so much for your time. Thank you for answering all these questions and being so informative. We love the conversation for today. Lots of great information to take in and to remember. And now to our viewers, remember, be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. You can also connect with us on our social media channels and check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, stay safe, stay healthy, and thank you so much for watching.